The purpose of today's video is to give an overview and insight into the two main clinical ophthalmic methods used to help detect dry eye. The two tests are the tear breakup time and the Schirmer test. Dry eye is a broad term associated with compromised lubrication of the eye. There are two main causes of dry eye. These are reduced quality or quantity of tears lubricating the overall eye. Before we go into the video on how to perform the tests, it's important to understand what the tear film is. The tear film is a liquid layer providing moisture to the cornea and conjunctiva. It assists in transporting waste from the ocular surface and provides an evenly smooth optical surface for visual function. It is made up of three layers. The oily lipid layer, which is more commonly known as the outer layer, and its role is to help to prevent evaporation. The water aqueous layer, which is the middle layer, and the mucin layer, which is the more inner layer. Dry eye also causes various symptoms for our patients. These symptoms consist of a stinging sensation, itchiness, transient blurred or hazy vision, red eyes, and a feeling of grittiness or as if something foreign was in the eye. It's also crucial to understand the causes of dry eye. Various things that cause this diagnosis are things such as irregularities associated with tear film, age is a common factor, contact lens use, environments with low humidity, lid abnormalities, lacrimal gland obstruction, some autoimmune disorders such as rheumatoid arthritis, a lower blink rate, LASIK and refractive surgery, exposure to irritants such as smoke, and trauma to the eye. The first test that we will be discussing today is the TBUT test. This test is used to measure the quality and stability of the tear film. The transparent tear film is stained with fluorescein and observed through the slit lamp. The time taken for dark spots or lines to appear in the tear film after the patient's last blink is then counted and recorded. Normal values vary in the literature. Sources have said 30 seconds, 20 seconds, or greater than 10 seconds is regarded as a normal value. However, a TBUT that is less than 10 seconds is abnormal and indicative of dry eyes. It is important to note that the distinction between tear film instability and potential corneal problems, for example, dark spots, lines observed consistently in the same area, is indicative of a corneal surface abnormality, such as epithelial basement membrane disease. In order to be able to successfully carry out this test, essential tools needed consist of a slit lamp, alcohol wipes to ensure patient hygiene, fluorescein strips and alkane eye drops providing local anesthetic to ensure patient comfort is achieved. Here is an image of the essential tools I have just identified. Here we have a quick overview of the slit lamp and what this machine looks like. We have now provided a video detailing a student orthoptist carry out correct machine setup. The first initial step taken is to ensure that the machine is turned on and that the brightness level is sitting at a maximal capacity of 2. The student orthoptist has moved on to ensure that the refractive error adjustment piece is suitable for her viewing. This student does not have a refractive error, therefore both eyepieces should be adjusted to be sitting at 0. From here, we can move on to setting the light on the setting of the broad beam with a Colbat blue filter, which is positioned straight ahead. Finally, we can see that the student orthoptist is now ensuring that the slit lamp machine's chin and headrest are both wiped down with an alcohol swab to ensure patient hygiene prior to testing. Make sure that the patient is sitting upright and both the chin and the forehead are resting properly on those rests. From here, it's important to line up the outer canthus of the eye with the marker that is sitting on the slit lamp. Before the procedure of this test begins, the student orthoptist must ensure that they sanitize their hands before the instilling of anesthetic drops is carried out. Prior to introducing the drops into the procedure, be sure to check that the correct drops are being used. Also check the expiry date and make sure that the patient is not allergic to the medication you are about to give them.
Hi Maddie, I'm going to put some drops in your eyes. Are you allergic to any anaesthetic or preservatives?
No.
Okay, I'm going to put some drops in your eyes, so if you can just look up to the ceiling for me.
Instruct the patient to sit up straight and tilt their head slightly back and to look up in order to be able to instill the drops correctly onto the lower lid. From here, move on to inserting the fluorescein strip. As a tip, it may be useful to instill anesthetic drops onto the strip itself prior to inserting it onto the cornea, just as an extra precaution to ensure patient comfort is achieved. Ask the patient to sit back positioned correctly onto the chin and headrest to commence the testing. The student orthoptist should begin to align the patient's eye correctly with the slit lamp. Once it's in focus, the patient is then asked to take one big blink and hold open for as long as they are able to. From here, it is the student orthoptist's role to count in seconds how long it takes for evident breakup of the tear film to appear. Be sure to remember to record down the results of the patient's breakup time. Within this demonstration, the patient's right eye tear film did not begin breaking up until 10 seconds. However, the left eye's breakup time began earlier, sitting at about 6 seconds. When interpreting results from TBUT, you must compare the value to the normative data. As stated, the normal value can range from anything greater than 10 up to 30 seconds. In this specific example, the patient's right eye is not of much concern. However, the left eye can be classified as being more of a dry eye. For the purpose of this video, we have provided an image consisting of what the student orthoptist is viewing when looking into the slit lamp onto the patient's outer eye surface. The areas of breakup can be identified as the black and grey areas amongst the blue surface area within the image. The second clinical testing method for dry eye that we will be discussing is the Schirmer. The Schirmer test is an assessment used to measure tear quantity in patients with suspected dry eye. This is achieved by estimating the amount of tear production during a given period of time. Essential tools required for the Schirmer testing method consist of Schirmer test strips, a device to keep track of testing time, such as a stopwatch, a ruler used to measure moisture on strip at the end of test, and alkane drops used for local anesthetic. Here is an overview of the procedure of the Schirmer test, which will be explained via video footage. Prior to testing, be sure to also sanitize your hands and ask your patient if they are allergic to anything, just as you would for the TBUT testing.
Are you allergic to any anesthetics or preservatives?
No.
Good. So we're just going to put these drops in so we can do the Schirmer test.
Perfect.
The first step is to apply anesthetics if the orthoptist has chosen to utilize them. It's important to note that some sources show that anesthetic may impact the results. Therefore, some clinicians choose not to use it. However, some patients may not be able to tolerate the strips in their eyes without it. From here, use aseptic techniques to remove the 2 strips from the sterile pack by opening the packet correctly as shown within this clip. Ensure that you move on to label both strips right and left. Bend each strip at the notch to create a 90-degree angle. From here, instruct the patient to look up and gently pull down the lower eyelid. Then hook the strip over the center of the lower eyelid and release it. Repeat these steps for the other eye. Ask the patient to gently close their eyes and to not squeeze tightly. Begin the timer set to 5 minutes. After 5 minutes, ask the patient to open both eyes and look upwards. Then you can move on to carefully removing both strips from the eyes. From here, it's the student orthoptist's role to measure the length from the notch to the end of the moistened area on the strip. Record the measurements and stick the strips into the patient's files. Results gathered from the patient within this video show a measurement of 14 mm for the right eye and 18 mm for the left eye with the use of local anesthetic. Once again, we must compare against normative data, which is in this case between 15 to 25 mm, and any abnormal range can be classified as anything less than 10 mm. Therefore, although the right eye is considered to fall just below normal range of 14 mm, it can be identified as potentially being problematic. The left eye is within normal range. In comparison to one another, both tests consist of various advantages. For example, the TBUT test is an easy one to perform, it's relatively fast, and it's much more comfortable for the patient. In comparison, the Schirmer doesn't require the use of fluorescein or drops, therefore can be seen to be more advantageous for the patient. It's more helpful in measuring tear quantity and provides a more objective measurement, and Schirmer strips can actually be placed into the patient's file for future reference if needed. On the other hand, both tests also have some disadvantages associated with them. For example, for the TBUT test, fluorescein may give a falsely low tear breakup time result, and any corneal surface irregularities may also impact the reliability of the result. Disadvantages associated with the Schirmer test are things such as a much longer testing time required. It's a much more uncomfortable test for the patient. The results can be variable and difficult to reproduce at times. The paper strips may also scratch the cornea or the conjunctiva, and it's difficult to determine the exact length of moisture absorption on the strip due to wet area being uneven or rounded. Another disadvantage is also that the environmental conditions may impact tear reflex and results. Thank you for taking the time to watch the video based upon the TBUT and the Schirmer testing for dry eye. Here is a copy of our references used to gather our information. Thank you.